Hi, welcome back to Mom and Jess Women Talk Show, our last episode in the Women Empowerment series. So today, we're treating a very interesting and very important topic. Just before we start, if you are new on this channel, hit that subscription button so you'll be kept in loop of subsequent episodes. So today we're treating the women wellness topic. We're discussing about diabetes and cancer basically. With us in the house is Dr. Mrs. Nokhuthula. She's been here last time, I think sometime back, some months back, and she really did justice to the topic. It was also a health topic. So believe me, you will get one or two things, especially with what we are faced with in these two lifestyle diseases, diabetes and cancer. I'm sure you will learn a thing or two. So sit back and make sure you catch up with Dr. Mrs. Nokhuthula. You're welcome to Mom and Jess.
Thank you so much for having me. Thank you.
Thank you. Please could you help us introduce yourself to you?
Hello viewers, how are you? My name is Dr. Dr Mavela-Olusanya. I'm a qualified homeopath with a keen passion and interest in complementary and alternative medicine.
Wow. That's a whole lot, guys. She's loaded in this area, and I'm very sure you get something. Make sure you drop your take-homes, comments, questions, whatever, contributions, just to bless others and also let us know that you'll be blessed as well. So Dr. Mrs. Nokhuthula, let's hit the show. We're talking about cancer and diabetes, right? So please just, tell us more about these two lifestyle diseases.
Alright, so the first thing we can do is define the two diseases as they are quite separate. When we talk about diabetes, we mainly have two types of diabetes. We have what we call type 1 diabetes, which is the insulin-dependent diabetes. Usually one is born with this type of or form of diabetes, and they are dependent on insulin injections daily. Then we have type 2 diabetes, which is more of the lifestyle-induced diabetes. It occurs usually later on in life. It can start off at any age, whether in your teen years or in your adult years, and this is the type of diabetes that is usually controlled via medication, being tablets, and also it can be controlled via lifestyle changes. And then another form of diabetes that we find, which is more of a situational type of diabetes, is what we call gestational diabetes, and this is more so for women during pregnancy. Yes. Due to the fact that the body is also going through the stage of being pregnant, we find that sometimes there is hampered insulin take up by the body, and usually children who are born to mothers who've had gestational diabetes tend to be quite bigger. Yes. Then when we talk about cancer, cancer is defined basically as an abnormal growth, and it can occur anyway in the body, on any part. Though we differentiate these growths into either a benign growth, which is usually a growth that's not as bad, it's not disrupting the function of the body, it's not as destructive, so you can live with it, it's not causing any harm. Then we have the malignant type of cancers, which are the ones where the growths are quite aggressive, they are harmful, there's tissue destruction, they distort how the body functions, and these are the most dangerous types, which we call the malignant cancers.
Wow. That's very, very insightful. Dr. Nokhuthula, let's try and understand the basic differences between these two illnesses. I understand they are lifelong diseases, but can you throw more light on their basic, differences?
All right. So when it comes to diabetes, for instance, especially being type 2 diabetes, that can actually be managed very well if one takes the necessary lifestyle changes and also is on their medication full on. It can actually be reversed, whereas type 1 is more lifelong, and the person has to be on their insulin injections throughout. When it comes to cancer, depending on whether it's benign or malignant, a benign one, you can live with it, no need to worry, unless of course maybe it's in an area that makes you feel quite uncomfortable, then the growth can be removed. But when it comes to the malignant types, those need to be treated. You need to pay attention to your body, the symptoms that you get, the changes that occur, and those require immediate medical attention, immediate medical diagnosis. And if you get the treatment in time, then usually the prognosis is good depending on the type of cancer that you have and where it is situated. So it is always very important, especially when it comes to diabetes as well as cancer, to get medical attention because they are life-threatening diseases.
Absolutely. Wow, interesting. Okay, cool. Shed more light on the risk factors, the likely risk factors for both of them.
All right, so with our type 2 diabetes, one of the common risk factors is our lifestyle, our diets. We take a lot of foods that are refined, that are too rich in carbohydrates and sugars, things like processed white breads, white rice, fizzy drink. We are not saying they're necessarily bad, but the quantity that you are taking, the times that you are taking them as well, increase the risks. Lack of inactivity, such as exercise, things that even show that you are most likely at a higher risk of developing type 2 diabetes, watching your weight, those are quite important things and risks that put you in harm's way when it comes to type 2 diabetes. Then with cancer as well, just the same. Though it is mainly considered a genetic type of disease, which means that within the family there's a history of cancer, which increases one's risks of developing cancer. But nevertheless, there are situations where when we look at the family history, no one has had cancer. However, there are risk factors that could be lifestyle, from the types of foods that we eat, the chemicals that are used in processing these foods, could be a risk for one developing cancer because we don't know how our body assimilates these synthetic chemicals. And then also it could be from the environment. So you could be saying that you're living a healthy lifestyle, you're exercising. Yes, you're eating well, but you're living in an environment, maybe there's so much asbestos dust within the air, or a lot of air pollution or water pollution that you are consuming, and then that would then put you at risk for developing cancers. Then when it comes to women as well, we also find that there are specific cancers that women get, and this is due to our own genetic makeup as well as women and our reproductive system. So these specific type of cancers you would find like breast cancer. Not to say that men cannot have breast cancer. Men can actually also develop breast cancer.
I haven't actually heard of a man having breast cancer.
It does happen. The only difference is that as women we have more of a developed chest, unlike males.
Really?
But when you do look at the anatomy of a male chest and a female chest, fairly similar, but the only difference is, of course, we have more tissue and more development. So men can also have breast cancer, which means that it's something that they need to look out for. Any changes that you see within the chest area, very, very important as well to seek that medical attention. Then certain viruses as well, such as HPV virus, which has been linked to cervical cancers, especially in women. Of course, in men, they don't have a cervix, but they could be carriers and transmitters of HPV virus to women. So this is where issues of sexual reproductive health are very, very important. We also have uterine cancers that women can have, ovarian cancers as well that women can have that obviously men would not have.
Dr. Nokhu, you've said so much, especially about the ovarian cancer and the uterine cancer and all of that. Can we just shed more light on a little bit, on the likely causes of those ones? Could it be used, as a result of what you eat, or for the women really?
Okay, so with cancers, it could be a variety of risk factors that could have caused the cancer. So when you do go in, you're always assessed, and the likelihood of the cause of that cancer can be determined if it's found, or sometimes it's not. But when it comes to women, one thing is that our reproductive health is very, very important. Like we've mentioned, HPV virus, different strains of it can cause cancers within the reproductive system of women. So being very, very cautious and protecting oneself when it comes to their reproductive health is very, very important. Another thing that you would find now is that even young girls who are teenagers are now being advised to get a vaccine to prevent HPV virus. Because when you get HPV virus, most of the time you cannot tell, and it festers in the body for years and years and years until it then develops into a cancer. So some of the signs and symptoms that you would feel, it would be asymptomatic, and you wouldn't know that you actually have been exposed to HPV. Yes. And some of the things that women need to look out for when we look at these specific cancers for women, we can start off talking about breast cancer. Is you look at the anatomy of your breast. When we talk about the anatomy, we're looking at how the breast looks, any changes you see one growing bigger than the other one. So those changes in size. One,
please, I would like to come in, because I think, like with my kids, I have one breast bigger than the other.
Yes.
So should I get worried about that?
All right. So naturally, one thing you will find is that your heart is located on the left side of your body. So we usually find that the left breast is slightly larger than the right breast.
Really? It's actually the left. So is this case with everyone?
Yes, it's the case with most of us women, and this is simply because there's a rich blood supply going to that area because of the location of the heart as well. So it tends to be a bit the cavity is a bit pushed out. So that slight difference, but once you start to see it grow much bigger, yes, and it's far much huge, or far much bigger than the right one, that's when you begin to worry. And these are changes that you actually see. So we talk about the size of the breast, we talk about excretions from the breast. Unless one is breastfeeding and it is milk that is coming out, we are fine with that. But any other fluids coming out of the breast besides lactation, then we begin to be worried. You look at the fluid, what color is it? Is it clear? Is it cloudy? Is it blood stained? Is it due to a trauma, or is it coming out by itself? We look at the skin as well around the breast area. We look at something that we call wrinkling. What is happening to the skin? Any changes in terms of color? Could it be red? Could it be black? Could it have altered as well? The shape of the nipple, when you look at it, is it folding inside? All of those types of changes, anything out of the normal, is what we would then concerned about and seek immediate medical attention for the doctor to test and determine. Then when it comes more to your ovarian type of cancers or uterine type of cancers, one of the main things that we look at is when a growth is within the pelvic region, this area, things are quite compacted, so there's not enough space in there. So once there's a growth, you're going to experience pain. So pain out of the ordinary, pain that is not associated, exactly, we pay attention to that. Pain that is not associated with your normal menstrual type of cramps or pain, take note of that. Even during menstruation as well, note what your flow is like, how many days it is, the nature of the menstruate coming out as well. Does it have a foul smell, the color of it, you know? I know sometimes women will say, oh no, I don't want to look, I quickly want to get rid of it. But it's good to check.
To pay attention to those things.
Yes, because you are noting, and from noting that you're able to see that, okay, with all these months, everything it's regular, it's the same. And if you notice something out of the ordinary, that should be an alarm bell, and you seek attention for that. So pain within the area, irregular bleeding as well. It's not the time of the month when you should be menstruating, but all of a sudden you are bleeding right? That as well is one of the signs and symptoms that we find with cancers, that they will cause irregular bleeding, as well as discharge. You note the discharge that is coming out during your cycle. As women, we pay attention to our discharge. Sometimes it is far much thinner, it's more liquid, sometimes it's a little bit thicker. So you pay attention to the type of discharge you are having and your cycle. Is it discolored? Is it thicker than normal? Is it what we call copious, which means is it too much more than normal? What kind of smell does it have? And anything that feels uncomfortable, that's a good thing that we as women possess. We have a wonderful nature where, you know, we can sense things.
Yeah, so, no, I think that God gave us naturally to discern, you know.
Yes. So anything that feels
out of the ordinary.
Yes, out of the ordinary. It's quite alright. Never be ashamed. Never be alarmed about it. Seek medical attention and let them test that and let them diagnose it for you. Because one of the things about cancers as well, just like you were mentioning before, that sometimes you notice that one breast is bigger than the other. Should I be alarmed? Sometimes, you know, we make our own self-diagnosis, which we don't advise at all, because you could make the wrong diagnosis.
Absolutely.
And you could go easily onto Google or any platform.
Google is so scary. When you type something, it gives you all the scary
and it can tell you all sorts of things. It can tell you scary things, or it can tell you things that make you feel relaxed about it. That's why medical attention is very important for us as women, and to never be shy about it, to never feel embarrassed about it, to be completely comfortable. And one thing that we always encourage women is to keep a diary. And lately now, with all these smartphones, there are apps that you can actually download. So you keep a diary of how you are feeling, because we also find that cancers, there are certain types of tumors that produce hormones as well.
Really?
Yes. So these affect how we function as women, even our mood per se. So you keep a diary, you log on how you are feeling, you log on either how you're feeling emotionally, mentally, as well as physically, the times that you have your cycle, any pains that you go through, any changes that you feel in your body. And as you go through that diary or through that app, the input that you put, you're able to pick up that this is out of the ordinary. Maybe I should go and see a doctor about this. And that is a good thing for us as women, to pay attention to our bodies and to keep a record. Because sometimes you get to the doctor and they'll ask you that, what is your cycle like? Is it a 28-day cycle? Is it a 30-day cycle? And you're not sure because you're not keeping a record. So it's a good thing to do.
It is a good thing to do. Oh, thank you so much, Dr. Mrs. Nokhuthula. Viewers, if you're watching, I'm sure there's so much you've learned already. I have learned a lot. I feel like I'm seeking free consultation right now. So thank you so much once again. So Dr. Mrs. Nokhuthula, let's just talk about areas a woman should pay attention to, like with regards to pap smear and the mammogram. At what age and at what interval do one need to follow up with such checkups, just to prevent one from having such diseases?
Yes. So the important thing, and I like how you've mentioned it, that there are specific tests that are done by medical practitioners to determine one's risk, or to diagnose if indeed there are any conditions that have developed. Now, any woman who is of reproductive age, that is where we start off at.
Wow.
Very, very important. Yes. The earlier the better. Once one reaches that reproductive health, to have a checkup. And once you go for your checkup, whatever comes out of the results of that checkup, you and your healthcare practitioner will be able to decide how often one should come, depending on what the results are. Sometimes they would like to repeat a test as well, to give a proper diagnosis and confirmation. Sometimes they can tell you can come back for a pap smear after a year or after 2 years or after 3 years, depending on your risk factors as well. Like we've mentioned women of reproductive age, we also mentioned women who are sexually active. So if one is not sexually active, the chances of one getting certain viruses associated yes, with risks to developing cancers are eliminated. So your healthcare practitioner will always advise you how often you need to come, when you need to have the checkup, and this is a regular process. So you should never say, oh, I've had it 5 years ago, 10 years ago, and
you want to follow up. You need to
Yes.
follow up. Wow.
Yes.
Thank you so much. Thank you so much for all of this. And for women that are suffering from cancer and diabetes, watching, because it is a very prevailing lifestyle disease. For any woman watching, I don't know if you have any advices. We can start with diabetes and we'll go into cancer.
All right.
And how to manage.
Okay. So when it comes to diabetes, if it is type 1 diabetes, it is very, very important. And most people who have been diagnosed with type 1 diabetes will have been trained on how to actually self-administer and give themselves an insulin injection, usually within the stomach area before a meal. It's very, very important for one to stick to that and ensure that they always have their medication ready and on hand for their daily doses. When it comes to type 2 diabetes, very, very important for us to look at our lifestyle, make the necessary changes that we need to. For example, becoming more active, and you can start off with simple exercises that one can do. Even walking is an exercise as well. Even doing house chores, that's activity, it's an exercise. 30 minutes is enough within a day, 3 times a week, very, very important. Looking at our diet as well, making the right dietary or food choices, very, very important. So shifting from what we call high glycemic index foods, things that are high in sugars. So instead of us choosing to have all these processed foods that are too rich in carbohydrates and sugars, let's look for alternatives. So instead of a fizzy drink, let's look for fruit juice that you can easily make at home. Instead of taking 5 or 6 slices of white bread, you can cut down to 2 slices of whole wheat brown bread, which is actually more filling. So nutrition plays a very, very important part, yes, indeed. Then when it comes to cancers, the most important thing, of course, is having a confirmed diagnosis of the cancer. And depending on the stage of the cancer, because when we look at cancers, we find that there are different stages, what we call stage 1 right up to stage 4. Now, usually with stage 1, it's not as aggressive, it's easier, manageable, whereas stage 4 is when it's usually towards its end and it is the more aggressive type of cancer stages that we find. So depending on the diagnosis that one is given and what staging they're at, there are different types of treatments, from radiotherapy, from chemotherapy, from drugs that one can be given, from surgery as well to remove the cancerous part. So it all depends, and this can only be determined by a medical practitioner, and more specifically a specialist in that field, yes, being an oncologist. But one of the things that we can do to prevent cancers is lifestyle again comes into play. So our choices of the types of food, yes, that we are eating, let's try and stay away from genetically modified foods. Let's try and stay away from foods that have too many additives, synthetic flavorants, colorants in there. I always say when you take when you go and buy something from the store and you look at the packet of the food, if you cannot read the name, don't take it.
Wow.
Chances are it's not really natural, it's synthetic, and it may even actually be a risk for you. So being cautious of the types of things that we take in, putting into habit that you go, you buy something, read the label, read the ingredients, read how it's been processed. That's very, very important. And not only with foods, but we also look at personal care products as well. The type of lotions that we are using, skincare products, baby powders as well. I'm sure most of us
use a lot of Johnson's baby powder.
Yes, yes. You will find that if you look at some literatures, talcum powders have actually been linked to certain type of development of certain types of cancers. Even the type, even the type of personal care products that we use, like antiperspirant roll-ons, etc. So make sure that you read the label of the products that you're buying, be it food, be it personal care, be it anything that you're using, even in the house for detergents, because you inhale those fumes, or you are touching, you are using different types of chemicals constantly. So being very, very cautious of what we eat, what we use, staying healthy as well is
it's a whole package.
Yes, a whole package indeed. Very, very important, because we find that when we look at our human composition, we are not only a physical being, but we are also an emotional being. We are also a spiritual being. We are also a mental being. So being healthy mentally, being healthy emotionally, being healthy spiritually, being healthy physically are all intertwined, because it has already been established that things like stress, be it emotional stress, mental stress as well, those types of things can actually lead to a disruption in the natural homeostasis of a body, the natural state of a body, and this can easily put one at risk of then developing any type of cancer.
Woo! This is a whole lot of information for all women. Thank you so much. Thank you. God bless you. Viewers, this is a whole lot. I think we'll have to play this and watch again to gain a lot of insightful information for you and I. You know, for myself, I've learned a lot, especially with that of talcum powder. In fact, I don't do without it. When I bath, I put it everywhere. So I think that I have to work on to stop. You know, so women watching, I do hope you've learned something. Please drop your take home. A recap is good to watch how you take care of yourself emotionally, physically, health-wise. Watch what you eat, what you drink, how you skincare products you use, and all of that. Well, we'll stop here on that note. Until then, see you next month.
Thank
Bye.
You. Bye.